Robert Ortiz. I am the Certified Peer Specialist for Fellowship Health Resources. The series of events started when I was 8 years old. I witnessed my mom first try to overdose and take her life. By the age of 16, I started becoming detached from my mom. I started exploring with drugs and, I started, harming myself. And by the time I was 18 years old, I found my mom underneath my basement steps because she had committed suicide. It was a hard thing to really experience. I never really got over it. I remember going into the military and having somewhat of a breakdown there because I felt as if my accomplishments would have been in vain. I saw a psychiatrist there. The psychiatrist diagnosed me with PTSD, said I needed to seek professional help. Unfortunately, I started using drugs and started self-medicating. I battled with that for a number of years. Basically, what happened was that I had to discipline myself. I had to say, no is no. I can't live that lifestyle anymore. I need to separate myself from that lifestyle.
When he first came on board, he wasn't sure if he could do the job, what kind of impact could he make. And I've seen him grow in the role, I've seen him become more confident, and he's learned a lot, and he wants to continue to learn, which I think is awesome.
Sharing my lived experience with the peers shows the commonality. It shows that we're mutual. It shows that I came from somewhere that isn't as far as from where they came from. I think it also opens the opportunity for them to share their own lived experience, where a lot of it is sheltered and they don't want to share it because it's re-traumatizing. Me in my position as a certified peer specialist, I'm the bridger of that relationship. That the staff can view the peer in a different light, not so much just on illness based, but to the history that made the person who stands in front of them.
Robert is a valued member of the team. His ability to communicate on behalf of the individual, their wants, their needs, their preferences, is valuable. He sits in our clinical meetings and he's their voice.
Robert's a funny guy, he goes up and beyond for everyone. Even though it's not in his job description, he just helps everyone out, as the best of his ability.
Doing this position and working with the peers definitely fulfills me because it shows that I'm wanted. It shows that people want you around them. It shows that, people are happy to be around you. But at the end of the day, did I do something that really helped somebody in their life? I personally can't see it, The people around me can, and they have that uncanny ability to see what I do to help peers.